Hey guys, today I'm going to talk to you a little bit about malignant hyperthermia in the surgery patient. So, what is malignant hyperthermia? Guys, I will be honest, this is something we as the perioperative team, especially anesthesia, take super seriously. This condition, it's rare, but it's extremely life-threatening if it occurs in a patient. It can be triggered by certain medications that are given to the patient to put them under general anesthesia for their surgery. It can occur in anyone, but is commonly seen in children, adolescents, and there's an increased incidence with certain genetic conditions like some muscular dystrophies. Guys, prevention is key with MH. So it's super important to know the signs and symptoms so that we can act quickly. Hypercarbia, muscle stiffness or rigidity are seen. Also, tachypnea can be seen, but maybe not if the patient has been paralyzed. So that's important to know. Also, the patient's blood may look very desaturated or dark at the surgical field during surgery. They have a high heart rate, low oxygen saturation, and acidosis, which can be metabolic and respiratory. Now, here is the sign that gives this condition its name. One of the last signs that is seen is an elevated body temperature. And guys, it will rise 1 to 5 Celsius degrees every 5 minutes. This is why it is important to recognize the initial signs and symptoms to stop this from happening immediately. So when can MH occur? So really the signs can occur during induction or maintenance of anesthesia and after the procedure. And guys, it may not occur after the first time with anesthesia, but it could occur after the second surgery. So we always need to be ready. And I just want to say that I've been a surgery nurse for a very long time, and I will be honest, I haven't seen malignant hyperthermia, thank goodness. I attribute this to a great assessment by anesthesia and the perioperative team, and also a protocol in place that everyone is aware of. And I just want to mention that we need to be prepared for MH in settings other than the operating room, especially in the ER, where patients may be given anesthesia for something like an emergent intubation. We always have to be ready for malignant hyperthermia when anesthesia is involved. Okay, so in terms of malignant hyperthermia, what should we assess in the patient? We want to ask our patients if they've ever had any issues that they can remember with anesthesia in the past. Patients are not always the best of historians, so asking them about a high fever or a heat stroke during or after surgery can help them to remember. Also, sometimes patients might say that they've never had surgery, but they did have a family member who died during surgery. This could be an indication of MH. Also, assess the patient for any genetic conditions or issues, and also assess their age. Okay, so what do we do if we suspect that our patient may have had or has a family history of malignant hyperthermia? It's super important to know your facility protocol and guidelines for this issue. So know your role in this situation. Most facilities, and the hospital where I work included, typically have an emergency malignant hyperthermia cart. If we think that there is a chance of malignant hyperthermia, the cart will be placed outside of the OR so it is readily available. You should also be aware of what is inside the cart so you have everything that you need. Time is critical and crucial to your patient's life if they have malignant hyperthermia, so be ready. So what do we use to treat the patient who is showing signs of MH? The primary drug used to treat this issue is dantrolene, which is a muscle relaxant. The patient will also be treated with cold IV solutions, diuretics. The arrhythmias and acid-base issues will be corrected, and fluid intake and output will be monitored. Instructions and supplies are typically included with the emergency MH cart. Okay, so which nursing concepts can we apply to MH? Clinical judgment is crucial for the safety of the malignant hyperthermia patient. The anesthesia team and the perioperative team members will work together and collaborate for prevention of malignant hyperthermia or treatment if necessary. Okay, so let's look at a few key points of MH. This condition is rare but life-threatening if it occurs. It's commonly associated with general anesthesia medications. It can occur in anyone, but there's an increased incidence in children, adolescents, and patients with certain genetic conditions. Signs of malignant hyperthermia are hypercarbia, hypoxia, muscle stiffness or rigidity, dark blood that can be seen during surgery. And one of the last signs to occur is an elevated temperature. We will assess our patients preoperatively for any history of anesthesia reactions or a high fever that they can remember during or after surgery. We're always also going to ask them about any family history of anesthesia reactions. If we recognize something, we will notify anesthesia and we can so that they can alter their anesthesia medications for prevention. Know your facility's policy and guidelines and also where your emergency MH cart is. If MH occurs in your patient, dantrolene is going to be the primary drug of treatment. We also use chilled IV solutions. We treat acid-base issues and cardiac arrhythmias, and diuretics are also given. We teach our patients to provide a thorough medical and surgical history. And as always, they can ask questions. Okay, guys, I hope you enjoyed this lesson and learned important information on malignant hyperthermia. Make sure you check out all the resources attached to this lesson, as well as the rest of the lessons in this course. Now, go out and be your best self today, and as always, happy nursing.